I had surgery on my hip in December 2014. About 7 or 8 months after that, I developed pain. The doctor at the time told me that it was iliopsoas bursitis, and he sent me for a shot. I went to see another doctor. He thought the hardware that was in my right hip was what was causing the problem. So he said, what I'll do is I'll do your left hip, and while I'm at it, I'll do a revision on your right hip, and that should take care of the problem. Well, lo and behold, it didn't take care of the problem. I developed the problem again, very similar to prior to the hip surgery, if not the same. When you really worked it, like playing golf, it would start affecting my gait, where I had to limp. That concerned me because one of the reasons I play, I love the game, but I like to walk. They sent me to see Dr. Tabaddor. They're a whole nother group and everything, but they sent me to see Dr. Tabaddor.
Wayne came in, when he finally saw me, he'd already been through the ringer, seen so many different specialists, been through multiple rounds of physical therapy, wasn't getting better, was super frustrated, was depressed because it was really interfering with his quality of life, his activities of daily living. He was an avid golfer. He hasn't been able to golf for a couple of years. So it really, truly affected him. The concern was, after he had a total hip replacement, was it the hip replacement itself or was there something else going on? And it was confirmed that it wasn't the hip replacement.
He said, I know exactly what the problem is. It's 100% treatable. I can take care of you.
After just kind of doing a very thorough examination and understanding the anatomy, identified that it was a structure in the deep groin called the iliopsoas, which is actually a fairly common generator of pain in the hip. A lot of people can have it whether they had a replacement or not. Oftentimes it gets confused with joint pain, it can be misdiagnosed, it can lead someone down a very different path. So making the right diagnosis is critical in getting the right treatment.
It was a quick surgery. I walked out of the hospital with virtually no pain. About 6 weeks later, I started playing golf. I have no more pain. Had I met Dr. Tabaddor before my second surgery, I don't think I would have ever had the surgery. And it's unfortunate because they send you after the replacement, not before.
I'm not saying he didn't need a joint replacement, but you can have more than one source of pain. Not everyone has arthritis has pain from arthritis. You can't be fooled by x-rays and let that lead you down a road. You really need to take the time to hear the patient, listen to their story, do a thorough examination, understand the anatomy, put that in the context of any imaging you have, and then make your diagnosis.
He helps people to understand what their problem is. He spends the time. He goes over everything with you 2-3 times. He gives you options. He's a lifesaver. Everybody I know, I recommend, even if they have the slightest little pain, whether it be in their knee or their hips, to go see Dr. Tabaddor first. If you need a hip, he'll tell you you need a hip. If you don't need a hip, he'll tell you you don't need a hip, and I trust him 1,000%.
10 years ago, I would have been completely surprised with his outcome. But after doing so many of these procedures, after patients have had a total hip arthroplasty and I've gone in and done releases and cleanups, the results are astonishing. They're almost instantaneous. And everyone does so well and it completely changes their quality of life. Now, it's kind of almost like an expectation for me. And I couldn't be happier for Wayne that he's able to do all those things. That was our goal.
My wife and I couldn't really walk, go on any kind of hikes. Getting in and out of the car sometimes hurt. Even sitting at home, it would ache. But now I have zero limitations. It's been truly life-changing. It allows me to do what I love to do, which is play golf.